Good afternoon, everyone, and welcome to PBA at Noon. I'm Paul Benwell, and I'm joined by my associate and colleague, Sophie Caesar. With us today is Reliq Health Technologies. It's a rapidly growing global telemedicine company that specializes in developing innovative virtual care solutions for the multi-billion-dollar healthcare market. iUGO Care provides real-time access to remote patient monitoring data, allowing for timely interventions by the care team to prevent costly hospital readmissions and ER emergency room visits. The last time Lisa was here, the stock was trading around 42 cents. It's been as high as $1.25 recently, settling in now around 95 cents. We're very pleased to have you with us today, Dr. Lisa Crossley. So please, whenever you're ready, go ahead. And for those of you that have questions, you have the Q&A box that you can type in your questions and we'll make sure that they're taken care of. Thanks, Lisa. Go ahead.
Thank you. I will just share my screen. And
yep.
Oh, there we go. Share. There we go. So this is our updated investor deck. If anyone's following our website, this was just posted last week. And forward-looking statements, I'll let you read that slide on your own time at your leisure. So who are we? Reliq is, as Paul mentioned, a rapidly growing company. We supply virtual care solutions to the multi-billion-dollar healthcare market. The US market for virtual care for chronic care management is currently worth $100 billion. So it's a very large and very rapidly growing space. Our platform benefits everyone, all of the different constituents in the healthcare system. So patients, clinicians, payers. We provide comprehensive turnkey solutions, including care management services that allow clinicians to seamlessly roll out new billable or reimbursable virtual care services. We receive recurring revenue from subscriptions. Our growth is organic and not by acquisition, and it's really fueled strongly by some industry tailwinds that we'll talk about later on. And we'll have very strong margins by the end of this year, over 75% gross and over 45% EBITDA, which is quite unusual in the healthcare space. And we expect to at least double revenues year over year, every year for the next 3 years. So we're just entering now a period of very rapid growth, and we expect that period to continue for the foreseeable future. So recent milestones, excuse me. At the end of June 2021, we achieved a revenue run rate that equates to profitability. So we hit a revenue run rate of $500,000 per month. And this will be our first full profitable quarter, the current quarter that ends in just a few weeks. We expanded this year across the continental United States, but also in Puerto Rico and into the US Virgin Islands. And we've signed contracts with clients that provide a pipeline of over 200,000 patients. We also refer to that sometimes as a backlog. So these are patients who we've signed contracts with their clinicians, their care providers. And we've also signed implementation plans. So we know this is going to be the staged rollout at each individual client. This is the timing. And we know that by the middle of 2023, we'll have at least those 200,000 patients onboarded. And that 200,000 patient count equates to about 120 million Canadian in annual revenues at full deployment. We charge an average revenue of $40 US per patient per month, although that increases when we add care management services. And the company does not need to raise capital to hit these revenue targets, because we are now profitable and will be throwing off a pretty significant amount of free cash given our margins by the first quarter of 2022. And we are going to be able to hit these very aggressive margins of a revenue run rate, or targets rather, of a revenue run rate of $2 million per month by the end of this year, this calendar year. And we do expect to be in a very good position to uplist to the NASDAQ next year. So I won't spend a lot of time on this chart. It's a lot of numbers that may not be super exciting. But one thing I do want to kind of talk about is, if you look at the multiples, so even at our high of $1.20, $1.25, our multiple that on the forecasted revenues is about 8x. And typical multiples in this space are anywhere from 5x for a very mature, slow growing, and maybe not terribly profitable company to 30x. But companies that are rapidly growing, have good profit margins, and are high growth, high profit, high margin companies tend to get multiples over 25x, in some cases significantly more. Livongo was acquired by Teladoc in the recent past for a multiple that was over 40x revenues. And that was at a time when Livongo was operating at a loss, so negative EBITDA margins. So really what the market looks for when they're valuing companies like ours is that growth profile, which we certainly will have. And then, profitability is a key metric, and definitely having those very compelling margins. Even now, Teladoc and Livongo are operating at single-digit EBITDA margins, which really just doesn't give you a lot of margin for error. So having those very compelling software as a service margins that we have will make a huge difference going forward in terms of how the market values us. Again, I won't spend a lot of time on this slide. This is something you can read at your leisure, but I will say this is the fourth company that I've run as CEO. And I've raised over 60 million in capital for the companies that I've been involved with. And overall, our team is not only extremely strong and very passionate, but very experienced, not just in bringing new technology to market, but also in growing ventures from kind of concept to commercialization to commercial success. So I have a very strong team behind me, or around me, I guess is more accurate. This provides a little context around our business. So we're targeting that 80% or that 20% of the population who account for 80% of all healthcare spending. So chronic disease patients tend to be what we call the super users of the system. So these patients who have congestive heart failure or high blood pressure, diabetes, chronic kidney disease, even asthma, dementia, these patients are frequent visitors to emergency rooms and are frequently admitted to the hospital. And the reason for that is that on a day-to-day basis, they're responsible for managing their own care in the home. And most of them don't do a great job of it. Less than 50% of them remember to take their medications as prescribed, and that alone accounts for a significant percentage of hospitalizations. And recently, over the last 4 or 5 years, the Centers for Medicare and Medicaid Services have really been moving away from fee-for-service based compensation, where the more often a clinician sees a patient, the more money they'll make, to more health outcomes based compensation. So it's really important for clinicians in the States, from obviously a healthcare perspective, but also from a compensation perspective, to find a way to drive better health outcomes with this particular patient population, the chronic disease patients. So our software platform is modular, and we also offer care management services, where we basically act as an extension of the physician's office and our care center, call center, which is staffed with CMAs or certified medical assistants or nurses aides or nurses, depending on what is needed. And they're able to review care plans, to go through the patient's chart, and these are all billable activities. They also can call patients when they're first onboarded onto the platform to make sure that they know how to use the devices they have at home, and which are just monitoring devices, which all of these patients are basically familiar with when they start on the platform, because they're just simple blood glucose meters or a scale that you step on if you have congestive heart failure, or a spirometer that you just blow into. So there's nothing complicated from a technology perspective for that patient who's typically elderly and quite ill. And because it's a modular platform, we're able to allow clinicians to provide a very broad range of virtual care services to their patients. And that translates to significant revenues for the clinicians. So just as an example of a use case, so we have a patient with chronic obstructive pulmonary disease living in her own home, and she experiences a gradual decrease in lung function. This is very typical, not just with COPD, but really with any chronic disease, that these patients start out at a certain level of health and then go through this gradual decline that usually ends in either hospitalization or an ER visit or some kind of emergency intervention. So without iUGO care, this patient may forget to use their spirometer daily, may forget to record the results, may forget what their doctor told them about when they should call them based on their results. And so as a result, their lung function will continue to deteriorate until it reaches a point where there are very strong physiological symptoms for the patient. So things like shortness of breath, doing basic everyday activities of care, and maybe a wet cough. And so the patient will end up at the hospital, either in the ER or admitted directly to the ICU. And typically with these patients, when they have an exacerbation, you're looking at an ICU stay of 1 to 3 weeks. So it's hundreds of thousands of dollars to the healthcare system. And with a COPD patient, because they breathe less deeply when they're having flares, and they're much more vulnerable to developing pneumonia because there just isn't the oxygen to the deepest parts of the lungs. So you get bacterial growth. And because they are not getting as much oxygen as they should be because they're having this constriction in the lungs, and they end up with multiple organ damage. So you can get damage to the liver, kidneys, heart, lungs from that lack of oxygen in the blood. It's what actually kills with COVID, is that multi-organ failure. And so you're looking at a patient who, will not only have a long and expensive stay in the ICU, but it's probably coming out with some permanent damage, and therefore will never really get back to the point she was at before this exacerbation. With iUGO care, it's much simpler. The patient's care team will receive an alert that it's been a few days and the patient's lung function is trending steadily downward. And the physician will call in a change in the patient's medication, so might add a steroid inhaler or even an oral steroid. Could send over a respiratory therapist to help the patient remember how to really breathe deeply and get oxygen to all parts of the lungs. They can send over a pulse oximeter to track the patient's blood oxygen levels and make sure that the medication is working appropriately. But the bottom line is the patient stays healthy and at home. And so this is a very typical course for a chronic disease patient who's on our platform, whatever their chronic disease is. We're able to do these small interventions in the home, but they have a tremendous impact, not just on the patient's health and their quality of life, but certainly also on healthcare spending. So the benefits of our platform for patients: you're improving health outcome, you're improving quality of life, you're reducing hospitalizations, and you're really alleviating a lot of that burden on the informal caregivers, the family caregivers who, have to go to the hospital when they have a parent or grandparent in the hospital, or have to get involved with their day-to-day care when you have somebody who's in the home and who's not stable and has no, kind of safety net like iUGO care provides. For providers, it obviously creates very compelling revenue streams, but beyond that, Medicare and Medicaid assess penalties to physicians if more of their patient population is admitted to hospital than the average standard Medicare Medicaid patient population. So there are significant financial clawbacks from Medicare and Medicaid for physicians whose patients develop these preventable complications, and we can help them avoid those. Since we started in 2018, Medicare has gone from one billing code valued at $59 to a multitude of billing codes for around 18 right now that allow our clinicians to receive at least $372 per patient per month, US dollars, when they are using our platform. So it's a really significant revenue driver for these clinicians. An average practice can make over $1 million in new revenue at very high profit margins using our platform. And those profit margins are very high because they're making $372 per patient per month, and we're charging $40 to $100 if they're also using our care management services. So our revenue model and opportunity, as I say, our average revenue per patient is about $40. We are seeing that trend up as we progress with the business. Our care management center or services, so if a physician wants to use our care management center, then we will typically charge $100 US per patient per month. And we're finding that more and more clinicians are recognizing that they can onboard more patients and serve more patients effectively and onboard much more rapidly if they use our care management services. So we're getting a lot of demand for that platform, which is great. And we're selling to skilled nursing facilities, physicians' offices, home health agencies, and the payers are Medicare and Medicaid primarily, although in some cases it's private insurers. And the market, as I said, is worth over $100 billion US. And right now we're targeting the 37 million Medicare and Medicaid patients who have 2 or more chronic diseases. But as we grow, that market will expand to include privately insured patients. And already Medicare and Medicaid have expanded. There's another 5 billing codes being introduced next year that cover a broad range of additional conditions. So our patient pool, particularly as the population ages and grows along with it every year. So our growth forecast, as I said, by the end of this year, we'll have done 11 million in revenue total. But we will also have hit a revenue run rate because we are in a period of rapid growth, and where just revenues collected isn't, the real marker. It's really that revenue run rate at a given point in time that gives you an indication of growth. By the end of this year, we'll have a revenue run rate of roughly 2 million per month, which translates to 24 million annually. So we're certainly looking at some very rapid growth now that we've come out from under COVID for the most part. And obviously there are ongoing issues with the Delta variant, but I think in a lot of ways that's driven clinicians to try to find ways to care for chronic disease patients over the long term without having to bring them into the office and expose them to communicable diseases. Next year, we expect that we'll do at least 32 million in revenue and uplist to the NASDAQ. And as I said, we expect we'll at least double revenues every year for the next 3 years. And I think in 2023, we will certainly have hit that critical mass in terms of patient numbers where our big data play, where we're licensing the data that we have on patients to pharmaceutical companies, governments, other researchers. And that'll become a really big asset and very key component of our business in 2023. So trends and tailwinds. This is really what's kind of driving this rapid growth in our business at this point. So as this population, as the general population worldwide ages and grows, there are more and more chronic disease patients. In part, that's because the older you get, the more likely you are to develop chronic diseases. And in part, that's because of lifestyle. So because we are a more technology-focused society now than we were 30 or 40 years ago, and people are more sedentary, and there's much more availability of food, especially fast food, processed foods, and the chronic disease patient population is growing significantly every year. And that's unlikely to change anytime in the foreseeable future. And as I mentioned, the Centers for Medicare and Medicaid Services have introduced not just the carrot with these financial incentives, but also the stick with these financial penalties. So clinicians are really motivated to prevent those preventable complications. And since 2018, you can see the trends in the healthcare industry and how strongly they're moving towards virtual, preventative, proactive care. So when we started in 2018, Medicare had introduced one billing code for remote patient monitoring, and clinicians could get reimbursements of about $59 per patient per month. And since then, there are now roughly 18 billing codes that are relevant that you can utilize if you're a clinician on our platform. And you can get an average of $372 US per patient per month. So the difference in the total amount that the clinician can take home now from just 3 years ago is enormous. And we know that Medicare and Medicaid have already introduced additional new billing codes for next year and increased the size of the reimbursement for the existing remote patient monitoring billing codes. So there's really a lot of strong momentum in that market that encourages clinicians and other healthcare providers to adopt our technology. And we see that through a steadily increasing number of inbound calls or inbound referrals, where, a lot of our sales now we get just from one of our clients speaking to a couple of their friends and saying, I'm really making money with this. My patients really are staying out of the hospital, and it's very, very simple and easy to use. And then their friends end up calling us. So we can get sort of one clinician in a community and end up getting all of the clinicians in the community because we have that track record, that 3 years of clinical data showing that the platform is effective, as well as having that data that shows that clinicians are receiving reimbursements and that reimbursement level has increased by over 500% over the last 3 years. And the reason that Medicare and Medicaid are investing that kind of money in these virtual care programs is because they're expected to save them tens of billions of dollars a year. So this is really a significant cost savings. If you implement our platform, and a patient is well, look at what a clinician receives, for example. So if a clinician's receiving from Medicare and Medicaid $372 per patient per month, so let's call that $4,800 a year Medicare and Medicaid are spending on that patient, but they're avoiding those hospitalizations that are hundreds of thousands of dollars. So it's a drastic reduction in the cost of care per patient. And that's really what's going to make Medicare and Medicaid and other health systems sustainable going forward. So that's our summary. I'm happy to answer any questions anyone may have. And I will stop sharing my screen.
Hi, Lisa. Thank you so much for that. It's really exciting. Anyway, we follow you like crazy, so I'm always happy to get an update. But let me get to everyone else's questions before mine.
Okay.
So we do have one here from Albert. Do you see any risks where Medicare regulations could negatively affect the business model in the future?
Yeah, I mean, when we started out, that was definitely a concern, but now that Medicare and Medicaid have conclusively proven to themselves that this does save not just money, but really significant amounts of money, and it is going to make their budget sustainable going forward, where there was talk even as recently as 5 years ago of Medicare and Medicaid being defunded because it just wasn't sustainable. And so all of the trends in the industry are really very much in favor of Medicare and Medicaid continuing to not just support these programs at this level, but increase the level of financial support for these programs. And I think in general, this is the future of healthcare. COVID has shown us that we cannot have chronic disease patients taking up the bulk of the beds in our hospitals. It just leaves us completely unprepared for any kind of emergency situation. And over the next 4 or 5 years, hospitals are still going to be dealing with COVID patients, but also with that backlog of elective procedures and everyone who was told they couldn't come into the hospital because all of the beds were filled with COVID patients. So we really need to find a way to keep chronic disease patients out of the hospital. And we've heard that from our clients, that the hospitals in their area where they have privileges are telling them, you can't be admitting chronic disease patients. We just won't have room for them. And it's a very, in the middle of COVID, it's a very difficult, dangerous environment for chronic disease patients who are much more vulnerable to COVID, even if they've been vaccinated. So I think the trend in reimbursement is going to continue up for the foreseeable future. I don't see there being any, pullbacks certainly, but I think it's not just going to be no pullbacks. It'll continue to grow.
Excellent. Who would you say your competition is if you're out there looking?
Yeah, so we don't ever end up in a position where someone says we're choosing between you and this. What happens, really we have something very unique in the market. Part of it is our patient experience. If you look at companies that, like TELUS, for example, has done a number of virtual care pilots in Canada. They use apps on tablets with proprietary hardware. The tablet has large print so that the elderly can use it. But the reality is these patients are quite elderly. They're quite ill. They have multiple complex chronic conditions, and they're not going to use an app on a tablet or a computer interface. They're not comfortable with technology. They'll use it for the first week or two when their grown children come over to help them. But after that, they forget where the tablet is. They forget to charge it. They're not interested in using it. They don't remember their login information. So, we've seen in those pilots that have gone on in multiple provinces in Canada, the TELUS pilots, that after a week or two, adherence goes from some positive amount to basically zero. So we've really worked hard to develop a patient experience that works for this particular patient. So it's very low tech. You have a device in your home or devices, if you have multiple conditions, and it'll tell you once a day, it'll actually speak to you and say, please step on me if it's a scale, or please come over here and prick your finger. It'll say that in whatever language you speak. So, really trying to meet patients where they are. And if you have an unconnected device, let's say you want to use a mercury thermometer, we can do our automated interactive voice recognition calling, where they'll get an automated call in whatever language they speak. We have quite a few, for some reason, Russian patients using that service, and they have glucometers or blood pressure cuffs that aren't connected or connectable. They're older technology, but that's what they're comfortable using. And so the system will actually call them and say, please, check your blood pressure or prick your finger. And then they'll read whatever the reading is. Yeah, the results into the phone. It's translated back to English or into our platform as data. And then the clinicians can be alerted immediately if that patient starts to run into trouble. So it's a very flexible platform. And as a result, when we're in the market, what we see are either device manufacturers like Dario or Abbott or FortCare who have their own software platforms that support their devices. A lot of those software platforms aren't aimed at physicians, they're patient apps. And so the patient can show their doctor the data on their app when they go into the office, but the physician can't bill for that. So it's very easy to get physicians to switch away from that. Physicians also hate having to log on to multiple different platforms. So it's part of why we can integrate with EMRs if they want, their EMR, their electronic medical record. But we allow them to track patients who have a very broad range of conditions, as well as doing mental health care coordination, addiction management coordination. They can track patients with dementia and make sure they're not wandering out of their homes. They can do fall detection. There's no other company that supports, all of those different devices and approaches to allow a clinician to have that one-stop shop. And the other thing that we sometimes see in the market, although less often now, are little, we call them mom and pop shops. So someone will have developed an Excel spreadsheet or something that does remote monitoring, but it only does remote monitoring. And really, in order to really leverage that full reimbursement, you need to be able to offer more than that, some of the chronic care management or behavioral health integration. So those platforms are very limited, and they don't have the kind of white glove service that we have. We do electronic pre-authorizations on every patient who's put on the platform, so we know they're eligible and will be reimbursed. And we do electronic claim submission, and then we can do the care management in the middle. So, it's a much more comprehensive platform than anything else that's out there.
So there's also here, it's a two-part question. Isn't MaxLink Health a competitor? So why would are they using your services?
So MaxLink Health doesn't have technology. We're the technology component. What MaxLink Health does is more what our call center would do, for example. So they do care management, but we found with some of their deployments, they're getting too big for their care management capabilities. So we are taking on care management for a lot of their clients. So the intent originally was that we would be the technology platform, and they would do some of the care management if there were physicians who needed additional support. But it's actually turned out that we're doing quite a bit of the care management as well. So.
Okay, excellent. So you mentioned during your last WSR interview that some clients have pushed their onboarding to early next year. Do you foresee others doing the same? Is this going to impact your total revenue and the run rate for the projections?
Yeah, I think I may have misstated that a little bit. It's not so much that we have clients who pushed it now. What we knew at the beginning of the year was that some clients were saying, we're going to probably have to wait till next year because of COVID. So skilled nursing facilities. So that's part of that 200,000 patient backlog. We know that, those clients aren't going to onboard until next year. And somebody was asking every time we announce a new contract, is that going to add to our total at the end of the year? And I think I was explaining that, some of the clients, we kind of will shuffle things around, and maybe some patients will be onboarded in January instead of December. It's likely going to work out to be the same number of patients. Our target for the end of the year is roughly 40,000. We're very much on track for that. And so, there may be some constantly as the business goes on, some shifting of which clients are onboarding when, but we'll certainly hit that target, the 2 million per month revenue run rate by the end of this year. There's no risk that clients are kind of as a whole deferring, but what we do sometimes is, say if there's a complex client who isn't 100% sure of their dates, and we've got somebody else who's going to be very quick onboarding and is ready to go and really wants to get started right away, we might sort of say we're going to focus on the quick and near-term client first. And so we're constantly juggling, but overall we're sticking to those implementation timelines. But we may move, there are some moving parts that we may adjust behind the scenes, but they're not, of course, making any material difference there.
So obviously everyone is very curious to what your quarter is going to look like. So we do have a question here saying if you're going to provide some insight on whether the quarter is going to be profitable or not prior to the earnings release in December.
Yeah, definitely. I mean, so our earnings releases, our annual audited financials from the end of June will come out in October. They're not going to be exciting at all because they're from 4 months ago and to 16 months ago. And as we'd said, all of our growth this year is really happening in the second half of the year. So I feel like you wait 4 months to get these financials, and by the time they come out, if you're a growth company, they're completely anticlimactic because they're looking so far back. Then a month later, at the end of November, we'll have the annual or quarterly financials for the current quarter. But certainly in early October, we'll be able to announce to the market, the profits from this quarter and some of the other metrics, just with the caveat that the financials aren't coming out for another 2 months. But definitely, we want to be able to, because we are a high growth company and the financials are always a backwards looking picture. We want to be able to keep people informed as we move forward of the growth and the targets that we're achieving.
Excellent. Paul, you've joined us. Do you have a couple of questions for Lisa?
Yeah, it's popped up, and this is earlier questions that came in. Your NASDAQ listing, you're talking about in next year that you're going to list on NASDAQ. One of the questions, explain the reasons behind the NASDAQ listing if the company does not need to raise capital right now. I can understand that you want the U.S. exposure because the majority of your business is U.S.
Yeah.
But do you really, I mean, there's an expense and there's a cost and everything else of going, and would there be a reverse split?
We're not planning a reverse split right now. I know that everybody thinks you need a reverse split, but I think we can get to the target stock price, that you need for a NASDAQ uplisting organically. And I think, really it's better if you do get to that share price organically than by doing a reverse split. And I've seen that.
Agreed 100%.
Correct. I see that fail on a regular basis. And I think it's important not to uplist to the NASDAQ until you are at a point where your company really will be of interest to the people who follow the NASDAQ. So you have to be fairly far along in growth. We could uplist now by doing some reverse split and financial engineering, but we just wouldn't hold the attention of investors who trade on the NASDAQ. I think it is important for us to uplist to the NASDAQ. For one thing, I think being on the TSX Venture exchange, that's a very foreign concept to a lot of our US clients. They don't know what the TSX Venture exchange is. And so having, a NASDAQ listing, I think gives you credibility for your actual customers. So, looking beyond shareholders and investors, I think it's a very good kind of, I'll say, marketing tool for customers. It just gives you a little bit more credibility. And it gives us, the ability to have more institutional investors participate. So there's lots of institutions in the States who won't invest through the TSX.V or the OTC in the States, but will invest certainly if you're on the NASDAQ. And I think having a larger institutional shareholding really translates to less volatility in the stock. So I think that's an overall positive for the shareholders. And it really has nothing to do with a raise since we're not planning one, but I still think it's definitely the right choice for the company at the right time.
Would you uplist to the TSX versus the venture?
I don't think there's really a lot of point in going to the TSX, either en route to the NASDAQ or, in parallel with the NASDAQ. It's extra expense and it's extra time that the team has to put in for a separate uplisting. And if we know that the NASDAQ is the right place for us, then I think, that's more of a distraction and a cost than it is a benefit.
Gotcha. What do we have? Any talks of acquisitions in the near future?
So, we have not obviously been a particularly acquisitive company since we first acquired CareKit Health in February of 2016, and that brought in the platform. And we've looked the whole time I've been with the company for potential acquisitions, but the challenge, and I'm not complaining, but the challenge of being kind of the first to market in your space is that there really aren't other competitors out there that if you bought them, you'd get their client base or patient base, and it could help you grow your business more quickly. And right now, when we go into a physician who's already using something else like a device manufacturer software, we displace them very, very easily. I mean, literally in one visit. So, the cost of acquiring customers is much cheaper for us, basically free, versus acquiring a company that has those customers and then having to, deal with the customers being potentially a little disrupted by the change in ownership and everything. So there's haven't been any compelling acquisitions for us yet, but certainly if anything comes up, we're very open to looking into an acquisition if there's something that would make sense.
I've got one last question, then we can wrap this up. If someone has two very different issues serviceable by different doctors/specialists, does the patient need more than one apparatus to notify the medical experts? Do you get a double fee out of this, or how does that work?
Yeah. So if you're under a specialist care for, let's say, rheumatoid arthritis, and your doctor is following your kidney disease and your COPD, so your family doctor will want you to have a spirometer to blow into, and probably a blood pressure cuff to track your blood pressure, so that that's a key early warning system in kidney disease. Whereas your rheumatologist is probably not going to need you to have a device at all, but might want you to be tracking things like your medication adherence, which we can do through automated medication dispensers, or might even want you to be through our IVR technology submitting symptom reports. So I'm having a lot of stiffness or soreness today, and so that they can kind of keep an eye on your symptom progression and decide if they need to put you on one of the biologics that helps arrest the progression of rheumatoid arthritis and arrest that damage. So technically, you could end up with different devices in the home, but they're pretty simple devices generally. And it is a situation where multiple parties would be billing for the same patient if there's a specialist involved, but often it's just that the family doctor is kind of coordinating everything, and whatever devices are in the home really depend on how complex the patient's clinical condition is. But we've definitely found, my own respirologist always says to me, you asthmatics are the worst at complying with what I tell you to do. You don't take your steroid inhalers. I'm actually very good about it, but as soon as you start to feel better, you stop taking the inhalers, and then you flare up again. But he said, and it's true, we've certainly noticed that in our patient population, as patients get older, when you're in that last decade or so of life, it becomes less about, this is bothersome, and more about, this is going to keep me alive. So we get really good compliance and adherence. So even if patients had to use a couple of different devices during the day to be tracked appropriately for their multiple clinical conditions, we get over 99% adherence. Patients really like using our system because it is very low tech and simple for them. It takes minutes out of their day tops, but it gives them that safety net, and they really feel like someone who actually knows what they're doing is following my condition, and they will contact me if there's an issue. So it takes some of the burden off them, but it also makes them feel that they're doing something very proactive to kind of keep themselves alive and give themselves good quality of life in that last decade or two.
One last question. Would you send some of your team into a patient's home to test them for COVID?
So we don't really send our team into patients' homes ever. And so we're not really set up for that. Home health agencies will sometimes go in and kind of hand deliver devices to patients because they can bill for that, but we don't really do that. Usually devices are just sent to patients. And so, we don't have people wandering around in patients' homes, which is part of why we're able to onboard very rapidly. If we had to go into each patient's home and have the staff for that, that would be much more costly and everything. So we wouldn't have the sort of infrastructure to go into patients' homes and do COVID tests. However, we could, through the Care Management Center, arrange to have a COVID test shipped to them and then do a video call, which is actually, across the border. I went to the States once in the last 18 months at the middle of June. And when I came back, I had to do a COVID test online with a nurse who kind of instructed me on how to do it. So we could certainly do that through our Care Management Center.
Right.
Yeah.
Well, Lisa, thank you so much for today. Very, very much appreciated. We'll
Right,
have you back.
thank you.
We'll have you back in a few months again
Great.
and bring us up to speed
Great.
on all the revenue that's coming in. Thanks to everybody that logged in today. Somebody asked a question, can you get your team to get me on their mailing list? I suggest you just go to Reliq Health's website, and there's a place there where you can get on their mailing list. You can get all the data you need from them.
Yep, exactly.
Thanks again, Dr. Lisa.
Thanks for having me.
And we'll,
Bye, Lisa.
we'll
Thank you
talk
so
soon.
much.
Take care. Bye, Sophie.
Bye-bye.
Bye, everyone.